The Department of Health is scrapping tracing for contacts of confirmed COVID-19 cases, except where infections were picked up in crowded places. In cases where a person has tested positive, they are still required to isolate for at least 10 days.
It means exactly that all quarantine will be stopped with immediate effect. It's based on the advice that we are actually picking up that the testing is now skewed towards symptomatic. That's actually what we never identified. Now, not all symptomatic people actually have been tested, and not all negative tests are true negative. So we have actually been advised that look at this time now, because of this challenge, we probably must then stop the quarantine and also stop this process.
Deputy Health Minister Dr. Sibongiseni Dhlomo says the decision to implement the new measures was made based on scientific advice.
Isolation rules are still applicable to both vaccinated and unvaccinated if you are actually tested positive, and we actually recommend that for 10 days, the isolation for symptoms for both vaccinated and unvaccinated if they have actually tested positive. We do have the best of our scientists in the world who are actually advising us. You would recall that as a ministry, we rely on the Ministerial Advisory Committee. They bring in, this is a new phenomenon in the world. Nobody is actually having a wealth of knowledge as to how they managed the pandemic 2, 3, 4 years ago. So we learn as we go along, but we are guided by scientists, and some of these are breaking very innovative findings that they advise us on, and then we take them along, and we actually advise the world sometimes on it.
For perspective on what our counterparts on the continent make of this, we're speaking now to medical expert in Ghana, Dr. Hanna-Lisa Tetteth. Dr. Tetteth, a very good afternoon to you. What is your reaction as the medical fraternity in Ghana on the South African government's decision to eliminate and bring an end to contact tracing?
Good afternoon, and thank you for having me. Well, I'll speak specifically to what we are doing in Ghana, because I believe that the South African government has their reasons for what they are doing. But I'll speak specifically to what we are doing in Ghana. As we all know, COVID-19 is not fully known. We don't have so much information on it. So when information comes and based on research, we do what we're supposed to do. But for now, what we're practicing is self-isolation, quarantine for at least 14 days, and then we test again after the 14 days to see whether or not you're positive, especially because asymptomatic patients are still able to transmit it. People who are fine and are not showing any symptoms at all are still able to transmit the virus. And so to be on the safer side, we are still going by the recommendations of WHO, which is to quarantine people, self-isolate, prevent them from moving, social distancing, so that we prevent the spread and the mutation of the virus.
So do you believe that the South African government's decision ahead of the WHO actually making those recommendations is a bit too soon?
Well, like I said, they probably have their reasons for their decision, but from what we know, we are rather being on the safer side and playing it safe in that we don't want the virus mutating, and then we don't want any more variants. So the most important thing to do is to prevent it from moving as much as we can. And that's why we do the self-isolation and quarantine when somebody is tested positive. That's why we're doing the social distancing and all, so that we can ensure that we don't get any more variants and we're able to deal with what we have currently. And so, yes, it seems a bit too soon, but like I said, they have their reasons. But we are still going with the self-isolation and then the quarantine, and then not allowing even asymptomatic people to walk around. Once you test positive, you need to go into self-isolation. So that's what we are doing.
Do you foresee this particular decision likely leading to perhaps more cases of COVID-19?
Well, it could lead to more variants of COVID-19 because the more we move, the more there's a possibility of replication, and then the more people are infected, and then the more they infect people, and we know all the consequences that come with it. And so to play it safe, we would have advised that there's still quarantine and then self-isolation even when the person tests positive. So that's what we would have advised. But I believe the South African government knows what they're doing. So.
As far as other countries on the continent and from the medical fraternity, is there, I guess, an exchange of best practice and strategy sessions that you have on how best to deal with COVID-19 in a way that perhaps, yes, is obviously specific to your own countries, but also has a more continental outlook to addressing this particular pandemic?
Hello.
Are you with us, Dr. Tetteth? Are you with us, Dr.?
I lost you.
You lost us. All right, let me repeat that. I was asking if you, as the medical fraternity, have perhaps a way of talking amongst yourself as experts so that you may have a more continental approach to addressing COVID-19 in as much as you operate as countries individually in your silos, but this also is a continental problem. Do you have those best practices that you share?
Well, sorry, I think I lost you for a while, but if I get what you're saying, if there are best practices, yes, we are going according to what the WHO is recommending, and that's social distancing, self-isolation, practicing the safety precaution, and even when the people are asymptomatic, once they test positive, treat them as though they were they were showing symptoms. So that's what we are going for. And self-quarantine and then isolation is part of what
Dr. Hanna-Lisa Tetteth, I think I will let you go now. Our connection failing us there towards the end of our discussion. That's medical expert in Ghana, Dr. Hanna-Lisa Tetteth, on the response from Ghana. They're still going to go ahead with the contact tracing. Better safe than sorry, they say, and they certainly will be following the WHO recommendations. Thank you, Doctor, for your time.